So there's a couple reasons why decompression therapy it works. But in order to understand why it works, we have to understand the conditions it's for. So whether it's a neck or a back injury, we can put your body in different positions to truly open up the area of the most concern and then apply a force in that direction. So one, it can be comfortable. And then two, it's effective. There are about 10 major reasons to consider for spinal decompression therapy. One would be a bulging disc. So a bulging or herniated disc, and that's where the disc will push out against the spinal nerve, and that's where you get that shooting radicular pain that goes down your leg. Another one is spinal stenosis. So stenosis, the word stenosis overall, is just the narrowing of the hole where the nerve comes out. So if the nerve lies in that spinal segment hole, if that hole narrows and gets tighter, it's going to encroach on that nerve, which leads to a similar symptom as the disc compression. Sciatica. We've heard the word sciatica, which is a really generalized term for pain that shoots down your leg. What about disc degeneration? I get many times individuals that come into therapy, they're there for their evaluation, and they pull out their x-ray and they say, look at this, I'm doomed. And I'll look and it'll say like mild disc degeneration. They're like, look, I'm falling apart. So disc degeneration is another one. Facet syndrome. So facet is parts of the spinal segment that come off and connect one segment to the other segment. So a bottom vertebrae to a top vertebrae, there's one common articulation or contact point. And that contact point can become irritated. Pinched nerves. Pinched nerves is a general term that we get, can occur from stenosis, can occur from bulging disc, it can occur from a centralized stenosis, so the spinal cord itself is becoming pinched by the bones, or a disc. We can get that numbness in the hands and the feet. So when you're getting radicular pain, or when you're getting numbness and tingling into the extremities, that is another reason why people would benefit from spinal decompression. And then the last little bit is just chronic neck or back pain overall. And this is truly best for individuals that have this chronic neck or low back pain that a lot of different treatments just really haven't worked. So spinal decompression is a great way that's safe, effective, and there's no surgery involved or invasive techniques.